Welcome to Session 3, Nutrition, Where Are You Now? These are the learning outcomes for this session. Welcome to Session 3, Nutrition, Where Are You Now? Click on the tab to enter. Arrow forward. Again, we discuss how our patients working towards improving their portion control in this instance, get them to score there, have that discussion of congratulating them for their achievements and just asking them what they think they might be able to do to get their score to a 10. Moving forward, same thing with our physical goals, they score that. Remember, you've always got the opportunity to set a new physical goal whenever you wish. Same with our lifestyle goals, we'll review how they're going with smoking less. And then if we want to review how they're also going with their buying the new activewear, we can click on that tab and record that also. Likewise, if we want to set a new goal, we can set a new lifestyle goal should you choose. Moving forward, we record our patient's weight again. The BMI is automatically calculated. They do the waist circumference and the steps. Moving forward, our 24-hour food recall has been pre-populated from our initial consult. So here we have a discussion with our patient of their intake of their food. As you can see here, their fruit intake, their goal has not been met, it's in the red. So you might have a discussion here with your patient saying, look, the recommended daily intake of fruit is 2, you're currently having 1. Can you think of a way that you might be able to include 1 more serve of fruit in your day? So have a discussion around that. They may or may not be able to, but have that discussion. Same with vegetables. The daily recommended amount is 5. They've scored a 2. Again, we would ask our patient, can they think of any way that they could increase their vegetable intake? Breads and cereals, again, they haven't quite met the quota there. We could have that discussion. Again, with milk products, they also haven't achieved their goal. You'll see here that they've managed to have 4 serves of meat, fish, poultry or meat alternatives. So they've met their goal of that. So their discussion could be, well, you know, you're doing well with your meat, fish, poultry or meat alternatives goal. Perhaps you may reduce that to 2.5 and perhaps you could include more vegetables as an example. This will vary from person to person. I'm just explaining this particular example here. With our extras, this is our discretionary food, or in other words, our extras are our bad choice food. So you can have up to 2.5 serves of discretionary food a day, which might include, you know, cake, biscuit, lollies, etc. But they've actually scored 5. So you might want to have a little bit of a discussion there of how they may be able to reduce their intake of discretionary food by replacing some discretionary food perhaps with some healthier options. As an example, they may want to replace 1 biscuit with 1 piece of fruit, or they might want to replace 1 piece of cake with a serve of vegetables at that meal. So this is just about having the discussion of whether they might want to. Again, with the water, they haven't had enough water there, so we could talk about introducing a little bit more water into their daily diet in this particular instance. This will vary for each patient. So now we have the opportunity to show our Australian Guide to Healthy Eating pie chart. We've got one here for the Aboriginal and Torres Strait Islander and also for our non-Indigenous people. So we can click on here and bring it up on the big screen and you can just go through and show them all the different food groups and what foods are in that. Okay, so once you've had a little shown your client of what foods belong in which group, we can click out of there and we can continue on. We'll have a little bit of a discussion about starting to make changes, and this is all scripted and it's all evidence-based information. So we could request that our patient base their meals on the Australian Guide to Healthy Eating and just discuss when your body gets the nutrient it needs from the core foods, it reduces cravings for sometimes foods or our poor choice or discretionary food that are high in kilojoules and promote weight gain. We can discuss the benefits of eating regularly and avoid skipping meals, and we can advise that we don't want to count kilojoules. It's hard to do, it's boring, and it takes away from the simple changes that we can make, which are simpler to achieve. We can offer a couple of really basic suggestions here, like swap drinks and cordials for non-caloric or diet versions, or even better still, choose water. We can talk about just slightly reducing portion sizes at each meal, and we could choose foods that fill you up more. What we've also got here is we've got a sample meal plan for women and men, and you could just show them what a sample daily meal might look like. This might not appeal to all your patients, but at least it makes them aware of and gives them an example of a nice healthy meal, and it shows that you can actually eat a decent amount of good quality food and still have a healthy diet. The other thing you might find a benefit on this page, and this is also in their resource section, is that you can go to the recipes tab here, and that'll take you to the Dietitians Association of Australia, who have examples of some healthy eating meal plans that you could click on. Moving forward, we've come to the conclusion of the session, and as per usual, we can review the report with our patient.